Is it an outpatient procedure now?
Usually they'll keep you overnight for those. Sometimes they don't.
Do they put a nerve block in?
Yeah, they'll put in a nerve block.
Okay.
Not all of them, but...
What's a nerve block?
So they actually go in and they cut the signal, the pain receptor.
With
nerve.
With drugs?
Yeah, with drugs, with chemicals. They don't actually cut the nerve or like block the nerve, but they just chemically kind of numb it for a while. Okay. It's kind of the same way that like lidocaine works. It goes in there and it just slows down the transmission of it. So.
Okay, and so that's one thing. What can you expect when that wears off?
Pain. It's coming, baby.
It's a nightmare.
Yeah, it's not comfortable. I think that was one of the questions I get the most. Is it gonna hurt? A lot. Like how bad is it gonna hurt?
You only sleep in a recliner. You can't fart. You can't pee anything without it.
Sneezing is the worst.
Yeah.
The first, I don't know how his is or how specifically his surgeon wants it, but usually the surgeons I work with, they'll want people in a sling, an immobilizer sling for about 6 weeks.
Okay.
And so you would wear that.
The ball.
Yeah, and you know why you squeeze the ball?
Blood, I guess. Right?
Yeah, blood flow.
Because you can't. All the edema.
You can't move your arm because you've had surgery on it, so you're not getting blood flow this direction. So you pump, and that works just like the calf muscle pump.
I remember all that.
Yeah.
I used to make shit up as I went. But...
yeah, the doctors sometimes don't explain that to patients. I'd say at least half of my patients have no idea why.
Or they tell them when they're drunk after surgery.
Oh yeah, they tell them.
They're
high as a kite, like what? Yeah.
Well, a lot of times too, they'll get the sling in the mail a couple days before the surgery, and then they'll put them in like a temporary sling to go home with.
Just like one of those like blanky slings that doesn't really do much.
And then they got this pillow when they come walking in with. Yeah, they got this big old thing.
Yeah, you got to wear the pillow here.
Yeah, the wedge.
You don't want it here. You want it.
To a certain degree, it needs to be.
And why do you want it in that degree?
It's more of an open position. It's open packed.
Open packed.
The more you move out of this position with the shoulder after surgery, the worse it's going to hurt. And you would think that, you know, whenever I'm doing passive on people to get their shoulders moving after surgery, the motion that hurts them the most is putting them into this position, into this slinged up position like this. I don't know why, but that position is always the one that
just
hurts
the most.
Man.
Yeah.
Now, here's another big question that I just thought about that kind of goes along with this is patients ask me all the time, do I take my pain meds before PT or after PT?
Yeah. Ooh, that is good.
And I'm like, well, you can't do both, obviously.
During?
You can't double it up.
Yeah.
So let's do a couple sessions and let's figure it out. Because some people, and I it's the same thing like with the hot pack. Like I'll put the hot pack on people before or after because it helps them calm down. That he feels good. They like it. They need to relax, right? So the thing about the pain meds is some people, they want to take it beforehand so they can get through the passive. And then they get home and they can chill out and then they can take the next one. It's like every 4 hours or whatever. Some people, they want to use the pain med as like the reward for making it through PT.
Oh, wow.
So as soon as they're done.
I shot a pill.
Yeah.
That's funny. Yeah.
So everybody's different. And like this guy I have right now that's locked up, I told him, like, look, you got to take your pain meds before.
Yeah, because it's going to be painful.
Yeah.
Well,
it's
locked up.
Like at most nurses or like at rehab centers, they try to, we always as therapists, like, please give them their medicine about 40 minutes before so it's taking effect, 40 minutes prior.
Because it's
like,
another thing.
Moving.
If you're in too much pain, you can't get the great therapy out of it. Because the pain can hinder what you do in therapy session.
And that's why I said earlier that you'll know if your therapist is right for you in the first couple sessions at least, is whenever I have a patient that I'm doing passive range of motion on, I am having a full-blown conversation with them about random stuff.
Yeah.
And I like people. I like talking to people. But I'm doing that because it helps them relax.
And
you can see it visually on people's faces that when you stop talking and you're still moving the arm, they'll grimace and they'll walk up, right? But you start talking, and then it's back.
Yeah.
So, I mean, we talk a lot. And if I have a patient that is not very talkative, doesn't want to do it. Like I have a guy right now. It's the same guy I was telling about. He comes in, he wears his headphones, and he watches YouTube videos while I do it.
And it still makes his mind distracted.
Mm-hmm. Yeah, and we talked a lot about breathing techniques. Breathing is so important. A lot of PTs I don't think focus on this enough. Like I have him before we start doing it do this thing where you cover up one nostril, you take 10 deep breaths through one nostril, out through the mouth, purse lips, and then 10 deep breaths through the other nostril. And you do 20 breaths, right? One in each side, and it has to come out through the pursed lips. And as soon as he does that, boom, we start. And that's a great relaxation technique. Next time you have about a minute to kill, 10 on each side.
Yeah.
And
10 on each side.
And you go all the way to full expansion too, like as far as you can go. Yeah.
Don't blow boogers.
Oh, like a.
So you
block
suck it in and out the mouth.
So I block it like this, or I go like this.
Well, you probably want to do it like this, because if you do it like that, you move the septum over.
Oh,
so like this.
Ew.
Yeah.
That sounds terrible.
You don't got to jam your thumb in there.
Oh.
And then
Block it off.
for the first lip breathe out.
Yeah.
Okay, cool.
Yep.
Cool, man.